Welcome, I'm Wendy Smith and I'm here as a postural spine alignment specialist to help you with posture. So it's really important to think about your chin, your neck, your scapula, which is your shoulder blades, and your pelvic stability. So I'm going to teach you a few tricks that will help you. They're really great little exercises. All you do is go up against a wall and straight away you can feel if your posture is straight. There are four main postures. One is kyphotic. So if we're on devices, not that we are all the time, but sometimes if we are watching, typing, rolling forward, that's kyphotic. The second is sway back. So you can see the lower lordosis and the butt comes out, and you might see strong people like this, or they've got a sore back. A third is on a slight angle. So you might have spondylolisthesis, you might have scoliosis, you might have some curvature in the spine, and then the fourth is the perfect posture. So I do teach Pilates as well, and Joseph Pilates was actually an anatomy chart model. So he formed his body so it was exactly perfect. The upper body the same as the lower, the left the same as the right, and that alignment is really imperative to prevent pain. So first is your neck. So pretend you've got chewing gum on your finger and you press your finger onto your nose and you pull your chin back, tuck the chin under. Like you're on train tracks, you want to just push that head slightly back. What does that mean? Go up against a wall and make sure you have the back of your head or skull onto the wall. What does that do? It takes the pressure off your posterior neck muscles here, and you strengthen them by pulling back. The second is scapular alignment. So your shoulder blades lack bony attachment. They only attach to one bone, which is your collarbone, your clavicle. That means it is only muscle that draws your shoulder blades back and down. So if we're shopping, cooking, cleaning, driving, washing, cooking, working, typing, watching TV, we need to then pull and draw our shoulder blades down and back into our back pockets, or shoulders away from the ears. So roll the shoulders, pull them back and down. And this is called a scarecrow. Can you get your elbows, your wrists, your hands, and your shoulders, and your back, and your rib cage touching the wall? It is quite challenging. So just keep going. All you have to do is literally stand there, and that's enough. And you can then add movement. Try and keep the shoulder blades there, and slide and glide the arms touching the wall, and feel your shoulder blades and what they do and how they move, and getting the lubrication of the ball and socket joint, your shoulders and your hips. So there's two ball and socket joints, shoulders that rotate and hips that rotate. Ball and sockets, because it's a ball in a socket. So another one with the hip, you want to feel, is your pelvic bone posterior or anterior tilted? So is it slightly forward or back? Try and get it into a neutral with a small little lower lumbar gap, and then your tushka. So again, up against the wall and feel that. Really, really great. Go up against the wall just for a couple of seconds. See you next time.